他们教授呢，就是讲它那个氧化用尽之后，活性氧的升高，然后会造成 NF。在正常情况下 ，NF2是跟 TP1是联合在一起的。当我们负氧作用的时候，它的活性氧升高，NF2和 TP1。然后激活 ARE， 其实它是通过 ARE， 它会影响我们的 FOD 肽的这个抗氧化酶的升高，然后通过抗氧化酶来达到对免疫炎症、组织重塑、细胞存活的影响。
下面 Emilia 讲。
下面请 Emilia 教授讲。Next one.
May I start? Hello?
Are there any more questions? Oh, yeah, please start. Please start. Yeah.
Thank you very much. I'm Emilia Serra from Brazil. I'm the president of the Brazilian Association Society of Medical Ozone Therapy. Nice to meet you here online today, and thank you for our Chinese colleagues. The goal of this presentation is to introduce the application of a multitasking medicinal gas as a useful tool for preventing and treat COVID-19. So we designed a clinical open phase 3 multi-center prospective comparative controlled randomized study to assess the effectiveness of systemic oxygen therapy with medicinal ozone therapy in early control of disease progression in patients with COVID-19 acute infectious respiratory symptoms. So we know COVID-19 caused by coronavirus type 2 is a new disease that causes an acute infectious condition, mainly respiratory, but now some nervous systems and cutaneous also symptoms. And this condition is mobilizing and worrying health professionals worldwide, and there is not specific conventional treatment yet. So this research was designed to understand and evaluate the effectiveness of a treatment that consists of the application of a mixture of two medicinal gases, oxygen and ozone, and as a complementary and in the treatment of people with these respiratory symptoms. So we know that ozone therapy is produced through using oxygen, medicinal oxygen, and it's always a mixture of oxygen and ozone, and the maximum concentration used clinically is it's only 0.05% of ozone, and more the majority is oxygen. So that's why it's known also as medicinal ozone oxygen therapy or oxygen ozone therapy or only ozone therapy. And as Professor Lamberto said, many actions of ozone are already known for many, many decades. So it has been used for clinical purpose about 130 years now. And we know the biological actions of ozone, and this optimization of oxygen release in the tissues and of the blood rheology also is one of more known. But this modulation of the inflammatory cascade of cytokines and upregulation of NRF2 system, very important. And also the stimulation of the synthesis of antioxidant intracellular enzymes. And besides that, vasodilation related to activation of nitric oxide synthase. And this is very important because we using these 4 mechanisms, we only with these 4 mechanisms it can be virucidal or virostatic, depending on the way it's delivered, but also acts against bacteria and fungus. And considering that many patients of COVID-19 have problems with fibrosis, lung fibrosis later on, it's very important to see that ozone can release a lot of growth factors from platelets and other cells, promoting tissue regeneration. So in Brazil, the Brazilian public health system had incorporated ozone therapy as one of the 29 integrative and complementary practices. It was done by the Brazilian Ministry of Health in March 2018. So it's officially in the program of the Brazilian Ministry of Health, but is still not so used. About ozone therapy safety, we have this study done in the 80s in Germany, and it had analyzed about 4.6 million treatments and found only 40 cases of mild side effects and only six deaths related to mainly to problems, technical applications. And so it gives rise to only 0.0007% of risk of complications and 0.0001% risk of death. So it's very safe procedure. It's the most, an extremely safe medical therapy. And besides these 6 deaths, only 1 more is described at PubMed. So we have only 7 cases of death known up to now. And it's important, and I will give this to our Chinese colleagues. You can see here the mechanisms, but I'll come back to English. So we know that this COVID-19 has 3 stages, and at the beginning, the viral response phase, and then it starts the inflammatory phase. So in stage 3, we have a hyperinflammation phase. And because of all the mechanisms that I already described, we can perfectly understand that ozone therapy can be used since the beginning. So the idea is that we can give this at the very beginning in order to avoid inflammation and this hyperinflammation state. So we have, because of the known mechanisms, we can say that we can observe general improvement in oxygen metabolism, increasing oxygenation and gas exchange in the lungs and peripheral tissues. We can restore the balance of cellular redox states. We can increase the synthesis of intracellular antioxidant enzymes. This promotion of interferon gamma induction. This is the main endogenous humoral mechanism of antiviral control. And we can see also the reduction of pro-inflammatory cytokines. We increase the effectiveness of antigen-antibody dynamics, the antiviral action, depending on the way, and vasodilation, and increase the tissue perfusion because of a nitric oxide activation. We see also modification and attenuation of the structural conformation of virions, the peplomeres that are the spikes on the surface of the virus, favoring the antiviral immune response. So we could imagine that it's possible a kind of auto-vaccine with this mechanism. The improvement of the blood conditions, reducing red blood cell aggregation, decreasing blood viscosity, and optimizing blood flow, and also favoring the regeneration of injured tissues due to release of growth factors, and using major autohemotherapy, and the second combining minor autohemotherapy and rectal ozone insufflation, of course, with a control group. And this will happen. We have already confirmation of participation of all of these centers. So we have a very big hospital related to heart disease in Manaus. It's in the north and Amazonas region, state in the north area of Brazil. And here in the southeast region, we have the participation of the National School of Public Health, that's Fiocruz from Rio de Janeiro. That's a very important center. They will participate in the outpatient arm of the study. And we have two campaign hospitals. This coronavirus coping center in Carapicuíba, that's city in the big São Paulo, and also Guarulhos Coronavirus Combat Center, it's a campaign hospital in Guarulhos, also here around São Paulo. That's the biggest campaign hospital in South America. And besides that, the clinical research centers in all Brazilian regions connected to SOBON, to our society. So based on the knowledge of the beneficial and widely known effects of ozone therapy, this study seeks to understand the effectiveness of this treatment in COVID-19, verify its ability to accelerate the clinical, laboratory, and radiological recovery of patients and who present with acute infectious respiratory symptoms, verify its actions in reducing the length of hospital stay and orotracheal intubation, and also verify the occurrence of a decrease in the occurrence of clinical complications and general symptoms of acute inflammation by at least 50% when compared to patients who will not receive this treatment. So the inclusion criteria to become a participant are people with acute respiratory infections, symptoms, both admitted to hospital or outpatient basis, of course with a laboratory diagnosis confirmed for COVID-19 through RT, PCR, or serology, both sexes age above 18 years old, it's necessary that the person sign the free and informed consent form and to be available to follow the proposed research protocol. We will admit 456 participants, and in all the centers I just said. So we will exclude, the exclusion criteria are the ones are deficient of G6PD enzyme, activity below 60%, pregnancy, women during breastfeeding, hyperthyroidism, to 80 to 200 milliliters, and I will talk about this later on. And we reinfuse the blood also after ozonation. And depending on the arm, we will do 7 up to 14 sessions. The omega Sobon protocol will make sure combining minor autohemotherapy and rectal insufflation. So we use these standard protocols, and I will talk about them a little bit better later on. So in the control group, the people admitted to this group will not be applied, will not receive ozone therapy. They will receive standard treatments. Exactly the same way. So here we have a resume of the protocol. So alpha protocol will receive major autohemotherapy, and the worst groups, critical, serious, and alert, we will receive one major autohemotherapy once a day, daily, 14 sessions. And as Dr. Baeza said, we expect that people will improve before this, but this is the official protocol. So the other one, the other arm, the outpatient basis, will receive every other day. So one day, yes, another day, no, one day, yes, again, and successfully. So 7 sessions. The Omega Sobon protocol, combining minor autohemotherapy and rectal insufflation, will be divided also in the 3 worst groups, and combining minor autohemotherapy, so once every other day, 7 sessions, and rectal insufflation twice a day, because we know that ozone is a little bit lost with rectal insufflation, so we decided to do like that to compensate this loss. And the other arm, we combine also minor autohemotherapy together with rectal insufflation, but this way, the second outpatient arm will receive only rectal insufflation once a day, so 14 sessions, and the other group, 28 sessions. And control group, no ozone therapy. So this is a resume. So the eligible participants will sign the free and informed consent form, and will be classified in 4 groups, and is randomized for receiving alpha Sobon protocol or omega Sobon protocol or control group. And we will have the outcomes. The patient is allowed to leave the study anytime, no problems. And we collect data, perform laboratory exams and imaging exams according to this protocol. We submitted this protocol to the National Commission of Clinical Research. That's a commission connected to Brazilian Health Ministry, and we are just waiting for confirmation of authorization to start the study. So this is a flow chart resuming the idea. So if the patient presents this acute infection system, he will saturation of oxygen up to 93%. That's the limit of worry to see if the patient is in risk of complications or not, clinically speaking. So if not, he goes to outpatient group and be monitored to these items, or if he goes to group 3 alert, he presents clinical deterioration or organs failure, goes to more intensive observation. So this is the way we decided to do. So there is a basic list of complementary exams, blood and urine. So we will see the complete evaluation, clinical basic one, and there is an extended list to using D-dimers and also ferritin, and we intend also to study this MTHFR mutation search and Leiden factor 5, because we suspect that some complicated patients, they can present this mutation. This is tetrahydrofolate reductase enzyme related to the ability to methylate. That's directly related to capacity of detoxify toxins, and also Leiden factor 5 related to coagulation problems. So ozone therapy is known related to very few discomfort, complication, and risks. Mainly risks related to blood collections, pain, infections, bleeding, or bruising, and sometimes short-term fainting associated with stinging needle pain, vagal reflex. So these are very simple to solve, using pain medication, use of antibiotics in case of infections, use of hydration through vein in case of pressure drop or vagal reflex, and use of serum of glucose through the vein in case of hypoglycemia. So we can see also with ozone therapy an increase or decrease of effect of other medications. So we must pay attention to this and adjust if necessary. So related to major autoimmune therapy, we have this, the same as the blood collections, pressure drop, palpitations, tachycardia, transient drop in blood sugar, headache, insomnia, itchy skin, stomach pain, nausea, fleeting sensation of head and redness of the body, tingling in the lips and fingertips, and the same short-term fainting, vagal reflex. So very simple to solve. Related to rectal insufflation, nausea, belly bugging, belly pain, intestinal colic, tingling in lips and fingertips, transient decrease in blood sugar, intestinal stimulation. That's not exactly a complication. So the alpha protocol, we describe here the group 1 to 3. That's the most serious. So we decided to use this 2 milliliters per kilogram of blood, and the same relationship with this medical ozone, concentration of 45 micrograms per milliliter. because we know from Professor Bocci's articles that around 45, 42, we have the delivery of interferon gamma, that's and other interferons also that are very useful for antiviral reactions. And for outpatient basis, we use the same concentration and doses and only 7 sessions, and the other group 14 sessions. So we have this table for organizing the information, and major autoimmune therapy is that. So from the omega Sobon protocol, we will combine minor autoimmune therapy and rectal insufflation. The same way, the worst groups, we will have this 7 sessions of minor autoimmune therapy in 14 days, and rectal insufflation, 28 sessions in 14 days. And for outpatient group, that's not so bad, a more light protocol. So we have also the tables and so on for comparing. And here, the progressive, we kept the concentration, and we decided to rise only volume through the beginning for rectal insufflation. The minor autoimmune therapy will be the same all the time, okay? So we use some scores to verify the results. So this is the World Health Organization score, and we will do this, apply these scores each 2 days in order to see what's going on, and we expect that we will have very good results very soon. So this is a proposal that we did. I did this protocol with my colleague, medical doctor, Dr. Gustavo Vilela from São Paulo, Brazil. And we are very excited to start the protocol and see the results. We are planning to have a meeting with the new Brazilian minister in the next week. So we imagine that we can help to change a little bit, at least, the course of this pandemic. So that's it. Thank you very much.
Thank you very much, Professor Maria Serra. Are there any questions? Thank you for your very interesting talk.
Thank you.
Thank you. Are there any questions?
巴西已经做了治疗了多少人？尤其是重型的病人、非重型病人，听得到吗？
The question is, how long did you test on the patients? How long did you do the experiment on the patients, especially the very serious patients?
Yes, depending on the randomization. It's the whole study will last about 60 days, 2 months, but the observation period and application of ozone therapy only 14 days, because we will repeat some lab exams and also image tomography at the end. So we will have this follow-up 60 days period for following up the patient.
我翻译一下，整个实验是60天，也就是2个月，但是开始做臭氧治疗是只有40天，因为还有很多的实验测试才能进行。
他已经治疗了多少病人了？
How many patients have you already treated?
Well, the study didn't start yet because we are waiting for authorization of the CONEP, that's the association of clinical research in Brazil. We cannot start any medical research protocol with this authorization.
这个测试还没有进行的，因为还没有得到批准。在没有得到批准之前，是不允许进行科学医学研究的。Thank you very much. Are there any more questions? Maybe we can discuss later.
Yes.
Thank you very much.
下一个刘文涛教授讲应用抽